Identify the chemotherapeutic agent. A. Furosemide. B. Levofloxacin. C. Lamotrigine. D. Methotrexate. E. Gabapentin. The answer is D. Methotrexate. Methotrexate is a chemotherapeutic agent. Levofloxacin is an antibiotic, lamotrigine is a mood stabilizer, gabapentin is an anti-epileptic agent, and furosemide is a diuretic. The oncology nurse cares for a patient receiving internal radiation treatment for cancer. Which of the following scenarios most concerns the nurse? A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. B. The patient complains about remaining on bed rest and asks to stand up. C. The nursing student stands away from the patient while talking to him. D. The charge nurse asks providers if they are pregnant before assigning them to this patient's care. E. The physician performs a physical assessment for 10 minutes. The answer is A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. When caring for a patient receiving internal radiation, the length of exposure to the radiation is a high priority for the nurse. It is important to rotate staff who care for the patient, limiting close contact to 30 minutes per 8-hour shift. Additionally, it is important to organize tasks so limited time is spent in the client's room. Visitors must also be limited. Pregnant women should not be assigned to work with this client. The patient must be on bed rest while sealed sources of radiation are placed. It is also important not to stand close to the radioactive source. Which of the following is not a proven risk factor for the development of oral cancer? A. Excessive alcohol consumption. B. Human papillomavirus, HPV. C. Regular use of alcohol-containing mouthwash. D. Tobacco product use. E. A diet with inadequate amounts of fruits and vegetables. The answer is C. Regular use of alcohol-containing mouthwash. All of the above are proven risk factors with the exception of mouthwash use. Poor dental care, prolonged present irritation, such as excessive flossing, tobacco and alcohol abuse, infection with certain strains of HPV, and an unbalanced diet can increase the risk of oral cancer. Which leukemia is linked to the Philadelphia chromosome? A. Chronic myelogenous leukemia, CML. B. Chronic lymphocytic leukemia, CLL. C. Acute myelogenous leukemia, AML. D. Acute lymphocytic leukemia, ALL. The answer is A. Chronic myelogenous leukemia, CML. The Philadelphia chromosome, which is an abnormality in chromosome 22, is most often found in bone marrow cells of patients with chronic myelogenous leukemia. It may also occasionally be found in acute lymphocytic leukemia, though this is rare. Reed-Sternberg cells are pathognomonic in what type of cancer? A. Non-Hodgkin's lymphoma. B. Acute myeloblastic leukemia. C. Acute lymphocytic leukemia. D. Hodgkin's lymphoma. The answer is D. Hodgkin's lymphoma. Reed-Sternberg cells are the pathognomonic cells of Hodgkin's lymphoma. These are mutated multinucleated B cells with a large amount of cytoplasm. These cells can be present in other pathologies. The diagnosis of Hodgkin's lymphoma can only be made if the Reed-Sternberg cells are in the presence of non-neoplastic inflammatory cells such as lymphocytes, plasma cells, and eosinophils. What protein is found in the urine of patients with multiple myeloma? A. Binns-Jones protein. B. Tau64. C. Albumin. D. Alpha-synuclein. The answer is A. Binns-Jones protein. Binns-Jones proteins are present in the urine of over 60% of multiple myeloma patients. Albumin may be present in the urine of these patients, but it is not pathognomonic for multiple myeloma. Alpha-synuclein is associated with neurodegenerative conditions, and Tau64 is a protein present in the neurons of patients with Alzheimer's disease. What is the most common symptom of Hodgkin's lymphoma? A. Bone pain. B. Fatigue and weight loss. C. Easy bruising. D. Prolonged enlargement of one or more lymph nodes. The answer is D. Prolonged enlargement of one or more lymph nodes. The most common symptom of Hodgkin's lymphoma is the painless enlargement of one or more lymph nodes. Unexplained weight loss and fatigue may also be present, but are more likely to present later than lymph node enlargement. Bone pain and easy bruising are not typically seen. What tumor antigen will be elevated in prostate cancer? A. Cancer antigen 125, CA 125. B. Tyrosinase. C. Prostate-specific antigen, PSA. D. Alpha-fetoprotein, AFP. The answer is C. Prostate-specific antigen, PSA. In prostate cancer, patients will have elevated levels of prostate-specific antigen, PSA. Cancer antigen 125, CA 125, is elevated in ovarian cancer. Alpha-fetoprotein, AFP, is elevated in hepatocellular carcinoma, and tyrosinase is an enzyme that is often highly elevated in malignant melanoma. The oncology nurse cares for a patient who has been newly diagnosed with leukemia. Which of the following sets of symptoms would the nurse not expect during the initial physical assessment? A. Mouth ulcers, low leukocyte count, weakness. B. Throat ulcers, pneumonia, anemia. C. Lethargy, bleeding gums, petechiae. D. Headache, ecchymosis, retinal hemorrhages. E. Weight gain, high red blood cell count, flushing. The answer is E. Weight gain, high red blood cell count, flushing. Leukemia is a cancer of white blood cells, limiting the ability of the body to fight infection. Patients with leukemia exhibit altered leukocyte counts, less than 500,000 per cubic millimeters, as well as ulcerations of the mouth and throat, pneumonia, septicemia, anemia, fatigue, lethargy, weakness, pallor, weight loss, headache, disorientation, and forms of bleeding, including bleeding gums, ecchymosis, petechiae, and retinal hemorrhaging. Patients with leukemia do not usually exhibit weight gain, usually loss, high red blood cell counts, usually anemic, and flushing, usually pallor. The oncology nurse cares for a patient newly diagnosed with breast cancer. What are common risk factors for this type of cancer? A. Immunosuppression, advancing age, genetic predisposition. B. Smoking, advanced age, genetic disposition. C. Stress, advancing age, chronic irritation. D. Pharmaceutical use, alcohol, radiation. E. Radiation, chronic irritation, smoking. The answer is A. Immunosuppression, advancing age, genetic predisposition. All of these may be factors in the diagnosis of cancer. The operative word in the question is risk. Common risk factors for breast cancer include previous immunosuppression, advancing age, and genetic predisposition. Common causative factors include smoking, alcohol abuse, radiation, chronic irritation, consumption of food additives, exposure to industrial chemicals such as asbestos, exposure to dangerous pharmaceuticals such as stilbestrol, previous viral infections such as Epstein-Barr, and stress, when combined with other causative factors. You are the nurse taking care of a patient newly diagnosed with ovarian cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in ovarian cancer patients? A. BCR, ABL. B. c-Kit. C. Prostate-specific antigen, PSA. D. Cancer antigen 125, CA125. E. Cancer antigen 199, CA199. The answer is D. Cancer antigen 125, CA125. CA125, also known as mucin 16, is a glycoprotein that is found to have elevated serum levels in patients with a variety of cancers, including ovarian cancer, and benign conditions, as compared to patients without such conditions. As a result, monitoring California 125 levels can be used as a method of tracking disease progression or response to treatment based upon what the initial CA125 level is at the time of diagnosis. On the other hand, the other choices are incorrect. Cancer antigen 199, CA199, is incorrect as this is a biomarker in pancreatic cancer, not ovarian cancer. Prostate-specific antigen, PSA, is incorrect as this is a biomarker in prostate cancer, and other prostate conditions, not ovarian cancer. c-Kit is incorrect as this is a biomarker in gastrointestinal stromal tumors, not ovarian cancer. BCR, ABL is incorrect as this is the translocation found in the Philadelphia chromosome implicated in chronic myelogenous leukemia, not ovarian cancer. You are the nurse taking care of a patient newly diagnosed with pancreatic cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in pancreatic cancer patients? A. Cancer antigen 125, CA125. B. CD20 antigen. C. Cancer antigen 199, CA199. D. BRAF. E. CD30. The answer is C. Cancer antigen 199, California 199. California 199 is often elevated in patients who have pancreatic cancer, or certain types of colon cancers, and can be used to assess response to treatment and/or disease progression. On the other hand, the other choices are incorrect. Cancer antigen 125, California 125, is incorrect as this is a tumor marker used to track ovarian cancer, not pancreatic cancer. CD20 antigen is a tumor marker for B-cell lymphomas and leukemias, not pancreatic cancer. CD30 antigen is a tumor marker for anaplastic large cell lymphoma, not pancreatic cancer. BRAF is a tumor marker for melanoma, not pancreatic cancer. Which of the following image modalities would be best suited to diagnose a suspected lung cancer? A. EKG. B. Chest X-ray. C. EEG. D. CT scan. The answer is D. CT scan. CT scan is the preferred imaging modality to view a tumor in the lung tissue. A chest X-ray might initially find a nodule or abnormal marking in the lungs, but it must be followed up with a CT scan to be diagnostic. EKG looks at the heart and EEG looks at the brain. You are the nurse taking care of a patient in an oncology clinic who was treated with chemotherapy and radiation therapy for anal cancer. The patient finished treatment 2 weeks ago. Which of the following treatment side effects would you expect to see? A. Fever. B. Pupil dilation. C. Eye redness. D. Headache. E. Rectal bleeding. The answer is E. Rectal bleeding. The patient is being treated with chemotherapy and radiation therapy for anal cancer, and is multiple weeks removed from treatment. Rectal bleeding is a very common side effect in patients who recently received radiation therapy to the anus, as numerous blood vessels are treated by the radiation therapy, and the body's immunologic response to radiation therapy also promotes vascular permeability. Rectal bleeding, unless profuse and uncontrolled, is often a self-limiting phenomenon in the setting of radiation, and while troublesome for the patient, does not pose much of an acute threat to the patient's stability. Or radiation therapy for anal cancer, fever is something that should be taken seriously in any cancer patient, especially one receiving chemotherapy. However, it should not necessarily be expected. It should always be assessed for. Headache is a common side effect in patients actively receiving chemotherapy, often either directly due to the chemotherapy drug itself, or to dehydration as a side effect of treatment, lack of appetite. This patient is multiple weeks removed from chemotherapy though, so headache would not be expected as a treatment side effect at this time. Pupil dilation and eye redness are not typical side effects of chemotherapy or radiation therapy for anal cancer. You are the nurse at an oncology practice taking care of an otherwise healthy 22-year-old male being treated with chemotherapy and radiation for Hodgkin's lymphoma. His chemotherapy regimen consists of doxorubicin, bleomycin, vinblastine, and acarbazine. He is not receiving any other medications. He reports feeling well aside from fatigue, and numbness and tingling of his hands and feet. Which of the following is the most likely cause of the hand and foot numbness and tingling? A. Diabetic neuropathy. B. Posterior spinal cord degeneration. C. Selective serotonin reuptake inhibitor discontinuation syndrome. D. Bleomycin-induced neuropathy. E. Vinblastine-induced neuropathy. The answer is E. Vinblastine-induced neuropathy. This is the most likely explanation for this patient's peripheral neuropathy, as the patient is described as being healthy aside from Hodgkin's lymphoma, and on no medications aside from his chemotherapy regimen. As a result, diabetic neuropathy and selective serotonin reuptake inhibitor discontinuation syndrome can each be ruled out as etiologies. Similarly, given that he is otherwise healthy and not complaining of any additional neurological symptoms, and given that he is young and actively receiving chemotherapy, it is unlikely that he is experiencing posterior spinal cord degeneration. Thus, in a young patient with lymphoma who is receiving chemotherapy and experiencing peripheral neuropathy, the most likely etiology is one of the chemotherapy medications that he is receiving. In this patient's case, he is receiving doxorubicin, bleomycin, vinblastine, and acarbazine. Of these medications, Vinblastine is the most strongly associated with peripheral neuropathy, as this is a fairly common side effect of vinblastine and other agents in the same class, vinca alkaloids. As such, vinblastine-induced neuropathy is the most likely etiology. You are a nurse at an oncology clinic taking care of a 65-year-old male with stage 1 non-small cell lung cancer, NSCLC, who is 1 year removed from a wedge resection and chemotherapy. Which of the following tests would be best to assess treatment response in this patient? A. CT, without PET. B. X-ray. C. Pulmonary function tests. D. PET, CT. E. MRI. The answer is D. PET, CT. PET, CT shows not only spatial information from the serial slices taken on CT imaging, which would include the size and location of any potential tumor, scarring, or nodal involvement, but also the FDG avidity or uptake of the contents of the image, which would help correlate the spatial findings with possible disease activity. Nodules observed on a CT scan can be nondescript, ranging from malignant, to indeterminate, to benign, which may still be infectious or inflammatory. The addition of PET to a CT allows the observer to see which nodules, nodes, or lesions are more likely to be indicative of disease burden, as tumors and infections will have greater FDG uptake since they are more metabolically active than surrounding tissues. MRI is not typically used to assess treatment in lung cancer, as CT coupled with PET is more commonly used. X-ray does not provide enough resolution to adequately assess response to cancer treatment. Pulmonary function tests, while a useful measure of lung functionality, do not give a specific picture of the lung cancer burden and as such are not the best treatment response assessment tool. You are the nurse in an oncology clinic taking care of a patient with a glioblastoma who has been receiving chemotherapy and radiation therapy. You want to assess response to treatment. Which of the following images would best assess treatment response? A. CT head without contrast. B. PET, CT. C. MRI head. D. X-ray head. E. CT head with contrast. The answer is C. MRI head. In evaluating brain parenchyma, which is relatively soft tissue, MRI provides the greatest degree of spatial resolution, which would best allow assessment of any residual, recurrent, or new tumor burden within the brain. CT imaging is commonly used to assess the brain when evaluating for bleeds or fractures, among other conditions, as it is far more expedient than MRI. However, it does not visualize the soft tissue of the brain parenchyma as well as MRI, and treatment response MRI scans are often not emergent, and therefore MRI would be preferred. PET, CT, while often highly useful in oncologic assessments, is of limited value in evaluating the brain for cancer response, because the entire brain is highly metabolically active in nearly all patients, and therefore the entire brain typically has a great deal of FDG uptake uniformly, limiting the value of the scan. A client had just undergone a total right knee replacement and has just returned from the operating room. Later that evening, the client suddenly begins to complain of shortness or breath and chest pain on inspiration. The nurse caring for this client further notes the coughing up of blood and that he is sweating profusely. Which of the following nursing interventions should the nurse perform first? A. Assess the client's mental status. B. Place in Fowler's position. C. Auscultate for breath sounds. D. Give oxygen. E. Draw blood for arterial blood gases, ABGs. The answer is B. Place in Fowler's position. The priority for this client is to ensure a patent airway by placing him the Fowler's or semi-upright seated position. Giving oxygen is warranted but will be given after the client is positioned correctly. ABGs would be helpful in this situation but is not the priority. Auscultation of breath sounds and assessment of mental status are not indicated. What is the final stage of a pertussis infection? A. The recovery phase. B. The convalescent stage. C. The post-infectious stage. D. The paroxysmal stage. The answer is B. The convalescent stage. The final stage of a pertussis infection is known as the convalescent phase. This occurs for 2 to 6 weeks, after the paroxysmal stage of the disease. During this time coughing decreases, and paroxysms are less severe. The infected individual may experience increased susceptibility to upper and lower respiratory conditions for as much as 6 months after resolution of the infection. Which of the following organisms causes whooping cough? A. Haemophilus influenzae. B. Bordetella pertussis. C. Human respiratory syncytial virus, RSV. D. Klebsiella pneumoniae. The answer is B. Bordetella pertussis. Whooping cough, a condition that results in severe paroxysmal coughing fits followed by a long wheezing inspiratory gasp, the whoop, is caused by the bacteria Bordetella pertussis. Haemophilus influenzae and Klebsiella pneumoniae both commonly cause pneumonia, and RSV is a virus that is frequently implicated in lower respiratory infections of infants and children. In pertussis, what stage follows the incubation, also known as the catarrhal stage? A. The whooping stage. B. The paroxysmal stage. C. The acute stage. D. The convalescent stage. The answer is B. The paroxysmal stage. After the catarrhal stage, an individual with pertussis will progress into the paroxysmal stage. It's during this stage that they will experience uncontrollable fits of 5-15 forceful coughs, followed by a whoop or gasp as they struggle to inhale. The force of these coughs can be such that they can result in vomiting, epistaxis, subconjunctival hemorrhage, or even broken ribs. How long is the incubation period for pertussis? A. 4 to 6 weeks. B. 1 to 3 weeks. C. 2 to 3 months. D. 2 to 7 days. The answer is B. 1 to 3 weeks. The incubation period for pertussis, also known as the catarrhal stage, can last as little as 4 days or as long as 42 days, but a typical period is 1 to 3 weeks. During this stage the disease looks like a regular upper respiratory infection, with sneezing, mild cough, and runny nose. The infected individual is highly infectious at this time, with bacteria spread by airborne droplets after sneezing or cough. You are the nurse taking care of a 40-year-old African American female who complains of fatigue and shortness of breath. Her physical exam is remarkable for erythema nodosum on the bilateral lower extremities. A chest X-ray is performed that demonstrates bilateral hilar infiltrates. She lives and works in a suburb, has not traveled outside of the United States recently, and does not work in a healthcare setting. Which of the following is the most likely diagnosis? A. Meningitis. B. Sarcoidosis. C. Lung cancer. D. Pharyngitis. E. Tuberculosis. The answer is B. Sarcoidosis. This inflammatory condition is frequently found in African American women in their 40s who present with fatigue and shortness of breath among other symptoms, who also have erythema nodosum on the lower extremities, and have bilateral hilar infiltrates on chest X-ray. This constellation of findings is highly suggestive of sarcoidosis. Sarcoidosis results in the formation of numerous non-necrotizing granulomas, most commonly found in the lungs, that can play a role in the symptoms experienced by these patients. Other findings suggestive of sarcoidosis include elevated serum calcium levels with normal serum PTH levels. Tuberculosis can present in a similar manner to sarcoidosis, however, given the patient's suburban living environment, lack of a travel history, and lack of healthcare exposure, the likelihood of being exposed to tuberculosis is very low, making sarcoidosis a more likely etiology. While lung cancer can present a shortness of breath with hilar infiltration in chest X-ray, in a relatively young otherwise healthy patient who also has erythema nodosum and in whom the hilar infiltrates are bilateral, sarcoidosis would be a more likely etiology. The patient does not have any findings consistent with meningitis. Legratian meningitis is petechial, not erythema nodosum, or pharyngitis. What is the hygiene hypothesis in asthma? A. Keeping children's hands clean will reduce asthma rates. B. Dirty water is responsible for many cases of asthma in the developing world. C. Frequent bathing can reduce the severity of asthma attacks. D. Exposing children to pathogens at a young age will decrease their risk for asthma. The answer is D. Exposing children to pathogens at a young age will decrease their risk for asthma. Incidence of asthma is lower in populations exposed to an abundance of microbes from a young age. The hygiene hypothesis suggests that early immune stimulation by multiple forms of infectious agents may push a Th1 phenotype, reducing the Th2, allergic, response. All of the following are common triggers for asthma except dash. A. Exercise. B. Squatting. C. Cold air. D. Emotional stress or excitement. The answer is B. Squatting. The most commonly reported triggers for asthma attacks are cold air, emotional stress or excitement, infection, irritants such as pollen or dust mites, and exercise. Other triggers may include lying down, exposure to cigarette smoke, or acid reflux. A patient has been administered isoniazid for the treatment of tuberculosis, TB. Which statement made by the nurse would be the most appropriate when teaching the client about this medication? A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. B. This medication is associated with color blindness. C. This medication is expensive and may only be taken subcutaneously. D. This medication must be taken twice daily for 9 to 12 months. E. This medication must be given by DOT, directly observed therapy. The answer is A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. Isoniazid is a bactericidal drug that is given for tuberculosis that has several adverse effects including peripheral neuropathy. This drug is usually administered in conjunction to other antitubercular drugs. Pyridoxine, vitamin B6, is recommended to be taken in conjunction with isoniazid to prevent neurotoxicity. Isoniazid is relatively inexpensive and may be taken orally or intravenously. It is not necessary to be taken under direct observation, and is usually dosed according to type of disease, active versus latent. The typical duration of administration is roughly 26 weeks. Color blindness is not associated with isoniazid treatment. All of the following changes may be seen in chronic asthma except A. Hypertrophy and hyperplasia of mucous glands. B. Destruction of alveolar septa and pulmonary capillaries. C. Epithelial desquamation. D. Deposition of subepithelial collagen. The answer is B. Destruction of alveolar septa and pulmonary capillaries. Chronic asthma can result in a situation referred to as airway remodeling, typified by the following changes: increased airway vascularity, epithelial desquamation, deposition of subepithelial collagen, and hypertrophy and hyperplasia of mucous glands and of the underlying muscle layer. Destruction of alveolar septa and pulmonary capillaries is a common finding in emphysema and does not present in asthma. At what stage are antibiotics effective in treatment of pertussis? A. Up to 6 weeks. B. Up to 2 weeks. C. Up to 8 weeks. D. Up to 4 weeks. The answer is D. Up to 4 weeks. Antibiotics have been shown to have very little effectiveness in treating a pertussis infection older than 4 weeks. Because of this, treatment with antibiotics to individuals that have been symptomatic for longer than 4 weeks is not generally recommended. A client is admitted to the ICU with acute respiratory distress syndrome, ARDS. The client has a recent history of bacterial pneumonia that has worsened and is at risk for hypoxemia. All of the following interventions apply to treatment for acute respiratory distress syndrome, ARDS, except A. An arterial catheter may be inserted to allow for blood pressure monitoring and ABG, arterial blood gas, blood sampling. B. Client may be placed in the prone position to increase the partial pressure of oxygen. C. Parenteral or enteral feeding will be necessary to meet high energy demands. D. The client should be given the highest concentration of oxygen that will yield a partial pressure of oxygen of 60 mm of mercury or greater. E. Daily weight should be taken to monitor fluid status. The answer is D. The client should be given the highest concentration of oxygen that will yield a PaO2 of 60 mm of mercury or greater. The oxygen concentration should be the lowest possible, due to the risk of oxytoxicity seen in clients with FiO2, fraction of inspired oxygen, levels exceeding 60% for more than 48 hours. A young male presents to the emergency department after a motor vehicle accident. Upon examination, it is found that the client will require a chest tube to reinflate his collapsed lung. All of the following correctly describe how a chest tube is placed except which of these? A. After placement, the tube is sutured to the chest wall and a dressing applied. B. During insertion, the tubes are to be clamped. Once in the pleural space, they are connected and unclamped at that time. C. A common location utilized for insertion is the fifth intercostal, mid-axillary line. D. If performed at bedside, sterile technique must be utilized. E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The answer is E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The correct placement of tubing includes directing a tube apically to remove air from the pleural space, and to direct the tube that will drain fluids in an inferior and posterior orientation. A 45-year-old male with COPD presents to the hospital with an exacerbation of his lung condition. He is in respiratory distress and the physician recommends he sit leaning forward. What is the purpose of sitting like this? A. To prevent falling. B. To help inhale air. C. To prevent loss of consciousness. D. To easily cough out secretions. E. To help exhale air. The answer is E. To help exhale air. COPD is a chronic lung condition marked by air trapping. Patients with COPD are instructed to sit in the tripod position to help them exhale air. Patients sit and lean forward to help maximize air exiting from the lungs. Which of the following best describes the mechanism of albuterol inhalers during an asthma exacerbation? A. Alpha-adrenergic antagonist. B. Beta-adrenergic antagonist. C. Beta-adrenergic agonist. D. Alpha-adrenergic agonist. E. None of these. The answer is C. Beta-adrenergic agonist. Albuterol is a beta-adrenergic agonist. It helps to open up the airways during an asthma exacerbation by activating the beta-adrenergic receptors, part of the sympathetic nervous system. Side effects include increased heart rate. What is the inspiratory reserve volume? A. The amount of air that can be exhaled after normal inhalation. B. The amount of air that can be inhaled after normal inhalation. C. The amount of air available in the lungs after exhalation. D. The normal amount of air that is inhaled with each breath. E. The total amount of air the lung can contain. The answer is B. The amount of air that can be inhaled after normal inhalation. The inspiratory reserve volume for the average adult is roughly 3,100 milliliters. It is tested using pulmonary function tests. The inspiratory reserve volume is the amount of air able to be inhaled after a regular inhalation. This is in contrast to the expiratory reserve volume, which is the amount of air that can be exhaled after a regular exhalation. Which of the following side effects would you most likely expect when providing an asthmatic patient with continuous nebulizer therapy? A. Bradycardia. B. Hypothermia. C. Tachycardia. D. Pinpoint pupils. E. Hypothermia. The answer is C. Tachycardia. Asthma is treated with albuterol. This drug is a beta-2 agonist, which works to relax smooth muscle in the lungs, and open up the airways. A consequence of this drug is the beta-2 effects on the heart. Beta-2 on the heart causes an increase in heart rate, tachycardia, and is a common side effect seen in the treatment of asthmatics. You are a pulmonology nurse taking care of a patient who complains of episodic wheezing. You perform a diagnostic test in which you perform pulmonary function tests on the patient before, and after administering albuterol, a beta-2 adrenergic agonist. You note that the patient's symptoms and FEV1 readings improve drastically with bronchodilator administration. Based upon these findings, the patient most likely has which of the following? A. Lung cancer. B. Chronic obstructive pulmonary disease. C. Sarcoidosis. D. Asthma. E. Throat cancer. The answer is D. Asthma. Asthma is an inflammatory airway condition that is characteristically improved symptomatically and quantitatively, in terms of pulmonary function tests, including FEV1 readings, with bronchodilator administration, for example albuterol, the beta-2 adrenergic agonist administered in this patient. In this patient who presented for evaluation of wheezing, a characteristic symptom of asthma, his substantial response to bronchodilator administration makes the likelihood of an asthma diagnosis very high. Chronic obstructive pulmonary disease, COPD, is an obstructive physiology of the airways often due to chronic tobacco smoking. While bronchodilators may be of some clinical value in these patients, their FEV1 readings characteristically do not correct after bronchodilator administration, as this is a major method in which COPD can be distinguished from asthma and other inflammatory airway conditions. Sarcoidosis, lung cancer, and throat cancer symptoms would not necessarily improve with bronchodilator administration, nor would pulmonary function test readings in patients with these conditions. A 45-year-old obese male with a history of obstructive sleep apnea, hypertension, diabetes, and coronary artery disease presents to your primary care clinic for help in managing his fatigue due to his sleep apnea. He is not a candidate for tonsillectomy and adenoidectomy. Which of the following interventions would be the best recommendation to treat his obstructive sleep apnea? A. Continuous positive airway pressure mask, CPAP. B. Metoprolol. C. Insulin. D. Metformin. E. Tamsulosin. The answer is A. Continuous positive airway pressure mask, CPAP. CPAP mask helps to force airway into the lungs that is otherwise obstructed by the patient's oropharyngeal anatomy as standard breathing pressures due to obstructive sleep apnea. When wearing a CPAP mask, typically when sleeping, snoring is reduced, and oxygenation is improved, allowing patients to have a more restful sleep and feel less fatigued the following day, while medications like metoprolol, insulin, and metformin may be beneficial to the patient in treating his conditions comorbid to obstructive sleep apnea, they do not have a direct effect on treating his sleep apnea or the resultant fatigue. Tamsulosin is an alpha-adrenergic blocker and can be used to treat benign prostatic hyperplasia among other conditions, but not obstructive sleep apnea. Which of the following best describes a diagnosis of uncomplicated or simple silicosis? A. Silica in the bloodstream but no clinical symptoms. B. Mild ventilation restriction and fibrosis on chest X-ray. C. Normal pulmonary function but shortness of breath. D. Massive pulmonary fibrosis visible on chest X-ray, but no extrapulmonary symptoms. The answer is B. Mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis results in mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis often results from long-term exposure to relatively low concentrations of silica dust, where symptoms usually appear 10 to 30 years after exposure. A 63-year-old female client is newly admitted to the hospital for pneumococcal pneumonia. The nurse recognizes that this patient will most likely exhibit certain symptoms associated with this condition. Which clinical findings are most commonly consistent with pneumococcal pneumonia? A. Headache, muscle aches, and a cough with frothy pink sputum. B. Slow onset of cough, nasal congestion, sore throat, and fever. C. Fever, chills, and a non-productive cough. D. Sudden onset of fever, chills, with a productive cough with rust-colored sputum. E. Dry cough with fatigue, nausea and vomiting. The answer is D. Sudden onset of fever, chills, with a productive cough with rust-colored sputum. Pneumococcal, bacterial, pneumonia typically presents with an abrupt onset of fever, shaking chills, and a productive cough, usually rust in color. Usually viral pneumonias will present with a dry non-productive cough and associated with other viral infections. What population is most at risk during pertussis infection? A. Infants. B. Adolescents. C. Pregnant women. D. Elderly. The answer is A. Infants. Due to their susceptibility to suffocation, infants are more at risk of mortality than older children, pregnant women, or the elderly during pertussis infection. Mortality in infants with this condition can be as high as 2%. There is also an increase in infant comorbidities such as pneumonia, encephalopathy, seizures, and failure to thrive. You are the nurse taking care of a 78-year-old man with a 60-pack year smoking history who is hospitalized for shortness of breath. You review the X-ray and notice a 1 cm solitary pulmonary nodule within the middle lobe of the right lung. Which of the following is the most appropriate next step? A. Attempt to obtain and review a prior X-ray. B. Refer the patient for surgical excision of the nodule. C. Arrange for a biopsy of the nodule. D. Administer radiotherapy to the pulmonary nodule. E. Administer chemotherapy. The answer is A. Attempt to obtain and review a prior X-ray. While the patient appears to have a very concerning story for a primary lung neoplasm given his age and smoking history, or a metastasis from another neoplasm, if this nodule was noted on a prior X-ray, especially a much older X-ray, and is unchanged, then the degree of concern about the nodule is much lower, given its stability over time. On the contrary, if you can obtain a recent prior X-ray and the nodule is not present on that scan, or has grown since that scan, then the level of concern about the nodule should be greater, and should guide clinical decision-making as such. Measures such as biopsy, surgery, chemotherapy, or radiotherapy administration are all possible future steps if indeed this pulmonary nodule turns out to be a malignant neoplasm. That being said, there is no definite evidence at this time that the patient's nodule is of malignant origin. And should this nodule be something that has been stable on prior X-rays for multiple of years, then the level of concern should be far lower, and the need for more invasive measures would be obviated. Which of the following terms describes the congenital abnormality of the forebrain in which an infant is born with a diminished brain size? A. Agyri. B. Microcephaly. C. Polymicrogyri. D. Anencephaly. The answer is B. Microcephaly. Microcephaly denotes a congenital abnormality of the forebrain in which an infant is born with a diminished brain size. Potential causes include fetal alcohol syndrome, congenital rubella, and trisomy 18. The other answers are all examples of congenital forebrain birth defects. Anencephaly is the complete absence of major portions of the brain, skull, and scalp. Agyri is the absence of gyri. Polymicrogyri is a condition in which gyri are too many, too small, and very shallow. Anencephaly and other neural tube defects have been linked to maternal deficiency of what nutrient? A. Calcium. B. Biotin. C. Folate. D. Beta-carotene. The answer is C. Folate. Anencephaly and other neural tube defects have been linked to maternal deficiency of folate. This is most likely due to folate's role in methylation and nucleic acid synthesis. The other nutrients listed are all important to maternal health but have no known correlation with neural tube defects such as anencephaly. Paraventricular leukomalacia, PVL, is the most common finding on autopsy of newborns with what condition? A. Fetal alcohol syndrome. B. Cerebral palsy. C. Anencephaly. D. Hypoxia. The answer is B. Cerebral palsy. Paraventricular leukomalacia is the most common finding on autopsy of newborns with cerebral palsy. PVL involves the softening of the brain tissue and subsequent death of the white matter. This is caused by lack of blood flow to the paraventricular area of the brain, which results in necrosis and gliosis of brain tissue. Neonates born with PVL are likely to have mental impairment, motor disorders, and compromised vision and hearing. PVL is usually diagnosed with ultrasound of the head. None of the other conditions listed typically present with this finding. A mother 1 hour post-birth expresses concern because her baby's head looks slightly cone-shaped. The nurse tells the mother that A. This is normal and usually temporary. B. This is normal but is not temporary. C. This is abnormal but does not require immediate medical intervention. D. This is abnormal and she should consult a neurologist. E. This is abnormal and she should contact her pediatrician. The answer is A. This is normal and usually temporary. It is normal for a child's head to be slightly misshapen immediately following birth. The infant's skull is composed of bony plates connected by membranes, fontanelles, allowing for accommodation of the baby's growing brain. Caput succedendum, swelling of the scalp, can also be found following a long delivery. A misshapen head usually resolves on its own and is normal but does not require any medical intervention. A baby is born with a heart rate of 99 beats per minute, irregular breathing, good flexion, frowns when you suction the nose, and with pink color throughout the body and limbs. What is the baby's Apgar score at 1 minute? A. 9. B. 8. C. 7. D. 10. E. 6. The answer is C. 7. An Apgar, appearance pulse grimace activity respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the Apgar scoring method, point allocations are as follows. Heart rate of less than 100, 1. Good flexion, 2. Frown, reflex, 1. Irregular respirations, 1. Pink skin color, 2. We add these to get the final Apgar score of 7. A baby is born with a heart rate of 60 beats per minute. The baby is not breathing, has limp limbs, is flaccid and pale. What is the baby's Apgar score at 1 minute? A. 1. B. 4. C. 2. D. 8. E. 0. The answer is A. 1. An Apgar, appearance pulse grimace activity respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the Apgar scoring method, point allocations are as follows. Heart rate less than 100, 1. Poor flexion, 0. Absent reflex, 0. Apnea, 0. Pallor, 0. We add these individual scores to get the APGAR score of 1. A pair of new parents are concerned because their baby has lost 4% of its birth weight at 3 days of life. The nurse instructs the parents to dash. A. Consider switching brands of formula. B. Continue feedings as usual. C. Feed every 5 hours. D. Notify a pediatrician. E. Feed only breast milk until the infant's weight increases. The answer is B. Continue feedings as usual. It is common for infants to lose up to 10% of their weight in the first week of life. Greater than a 10% loss indicates a problem. For an infant within these parameters, there is no need to make a change in feedings. Infants in the first week of life should be fed every 2 to 3 hours if breastfeeding and every 3 to 4 hours if formula feeding. Julie is a new registered nurse who is assessing a child in his 3rd month of life. The assessment is part of a routine appointment at a public health clinic. She knows that the anterior fontanelle of most infants closes between A. 18 to 20 months of age. B. 3 to 6 months of age. C. 1 to 3 months of age. D. 6 to 9 months of age. E. 12 to 18 months of age. The answer is E. 12 to 18 months of age. The anterior fontanelle is commonly referred to as the soft spot located atop a child's head. It allows considerable brain growth until it closes, generally between 12 to 18 months. However, the fontanelle may close on some children as early as 9 months. Which of the following is considered a late sign of hunger in the newborn? A. Crying. B. Sucking motions. C. Bringing hands to chin. D. Rooting. E. Chewing on the fists. The answer is A. Crying. Crying is considered a late sign of hunger. By the time the infant cries, they may be more difficult to console or to feed, especially if breastfeeding. Feed on cue when the infant is rooting, making sucking motions, or when they are frequently bringing their hands to their face or mouth. Which of the following should the nurse do if he or she finds a baby with irregular breathing? A. Check oxygenation through a portable pulse oximeter. B. Note the finding on the patient's chart. C. Check for oral obstruction of the infant's airway. D. Deliver oxygen through a simple mask. The answer is B. Note the finding on the patient's chart. It is normal for infants to breathe irregularly. Often, brief periods of apnea are present. Infants should breathe between 30 and 60 times per minute. For this purpose, noting the finding as a vital sign in the patient's chart is the correct action. No further intervention is necessary in response to a normal assessment.